Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. A client delivered a stillborn male at term. An appropriate action of the nurse would be to state, "You have an angel in heaven." Discourage the parents from seeing the baby. Provide an opportunity for the parents to see and hold the baby for an undetermined amount of time. Reassure the parents that they can have other children. The correct answer is provide an opportunity for the parents to see and hold the baby for an undetermined amount of time. Parents need time to get to know their baby. A 44-year-old client had an emergency cholecystectomy 3 days ago for a ruptured gallbladder. She complains of severe abdominal pain. Assessment reveals abdominal rigidity and distension, increased temperature, and tachycardia. Diagnostic testing reveals an elevated white blood cell count. The nurse suspects that the client has developed gastritis, evisceration, peritonitis, pulmonary embolism. The correct answer is peritonitis. Peritonitis, inflammation of the peritoneum, can occur when an abdominal organ, such as the gallbladder, perforates and leaks blood and fluid into the abdominal cavity. This causes infection and irritation. A 29-year-old client is admitted for a hysterectomy. She has repeatedly told the nurses that she is worried about having the surgery, has not slept well lately, and is afraid that her husband will not find her desirable after the surgery. Shortly into the preoperative teaching, she complains of a tightness in her chest, a feeling of suffocation, lightheadedness, and tingling in her hands. Her respirations are rapid and deep. Assessment reveals that the client is having a heart attack, wanting attention from the nurses, suffering from complete upper airway obstruction, hyperventilating. The correct answer is hyperventilating. Tightness in the chest, a feeling of suffocation, lightheadedness, tingling in the hands, and rapid, deep respirations are signs and symptoms of hyperventilation. This is almost always a manifestation of anxiety. Which of the following findings would necessitate discontinuing an IV potassium infusion in an adult with ketoacidosis? Urine output 22 ml per hour for 2 hours. Serum potassium level of 3.7. Small T wave of ECG. Serum glucose level of 180. The correct answer is urine output 22 ml per hour for 2 hours. Adequate renal flow of 30 ml per hour is a necessity with potassium infusions because potassium is excreted renally. The physician orders haloperidol 5 mg intramuscular injection stat for a client and tells the nurse that the dose can be repeated in 12 hours if needed. The most likely rationale for this order is the client will settle down more quickly if he thinks the staff is medicating him. The medication will sedate the client until the physician arrives. Haloperidol is a minor tranquilizer and will not oversedate the client. Rapid neuroleptization is the most effective approach to care for the violent or potentially violent client. The correct answer is rapid neuroleptization is the most effective approach to care for the violent or potentially violent client. Haloperidol is a high-potency neuroleptic and first-line choice for rapid neuroleptization, with low potential for sedation. The doctor has ordered a restricted fluid intake for a 2-year-old child with a head injury. Normal fluid intake for a child of 2 years is 900 ml in 24 hours, 1300 ml in 24 hours, 1600 ml in 24 hours, 2000 ml in 24 hours. The correct answer is 1600 ml in 24 hours. This value is correct. Normal intake for a child of 2 years is about 1,600 milliliters in 24 hours. The nurse is admitting an infant with bacterial meningitis and is prepared to manage the following possible effects of meningitis: constipation, hypothermia, seizure, sunken fontanelles. The correct answer is seizure. Seizure is often the initial sign of meningitis in children and could become frequent. The nurse is caring for a 2-year-old girl with a subdural hematoma of the temporal area as a result of falling out of bed and notices that she has a runny nose. The nurse should call the doctor immediately. Help her to blow her nose carefully. Test the discharge for sugar. Turn her to her side. The correct answer is test the discharge for sugar. Cerebrospinal fluid is positive for sugar, mucus is not. A 2-year-old child with a scalp laceration and subdural hematoma of the temporal area as a result of falling out of bed should be prevented from crying, falling asleep, rolling from his back to his tummy, sucking his thumb. The correct answer is crying. A child with a subdural hematoma has increased intracranial pressure. Crying may significantly increase this pressure. A husband asks if he can visit with his wife on her ECT treatment days and what to expect after the initial treatment. The nurse's best response is, "You'll have to get permission from the physician to visit. Clients are pretty sick after the first treatment. Visitors are not allowed. We will telephone you to inform you of her progress. There's really no need to stay with her. She's going to sleep for several hours after the treatment. Yes, you may visit. She may experience temporary drowsiness, confusion, or memory loss after each treatment." The correct answer is yes, you may visit. She may experience temporary drowsiness, confusion, or memory loss after each treatment. A family member is encouraged to stay with the client after return to the unit. The nurse has used an opportunity to do family teaching and allay fears by explaining temporary side effects of the treatment. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.